Hi, I'm Dr. Jessie with Chiro for Moms, and I'm here with Katelyn Neufeld. She is a midwife in a hospital setting. So today we have the unique situation where we get to talk about the differences between hospital setting and a birth center, or more of an individualized clinic, and kind of the things that she can do and does do, and the things that she doesn't do. I'm going to let her lead the way. I will guide if necessary, but without further ado, Katelyn.
Good. Yeah, I'm Katelyn Neufeld. Yeah, I'm a nurse midwife, and so there are, kind of a few different facets to midwifery care. And so most nurse midwives start as labor and delivery nurses. They get their kind of bachelor's degree in nursing and then go on and either get their master's or their doctorate in nurse midwifery. And then we're kind of co-licensed as both midwives and nurse practitioners. So we do a combination of well women care as well as pregnancy, birth, postpartum care. We can work both in the hospital-based setting and the out of hospital-based setting. I currently work in a hospital-based practice. And so for a lot of people, we feel like kind of this middle ground between out of hospital midwifery care versus your kind of traditional OB care that you would get in a hospital-based clinic in a hospital. So we take care of low and moderate risk pregnancies. So things that would, potentially risk someone out of our care would be like severe preeclampsia, needing hypertensive medication, or really poorly controlled diabetes, or someone needing surgery. We, do regular vaginal deliveries and repairs and postpartum care, and then as well as well woman care, things like birth control and STIs and preventative care and that sort of thing. Um, I'm currently at the Park Nicollet practice at Methodist Hospital, and we kind of offer the kind of full spectrum of labor care, I would say. So if you want to get an epidural, that's an option. If you want to go without, that's totally an option and something that's supported. We do water births there. So for people that are looking for that option, it can be a really nice option to be in a hospital setting that, in the case of an emergency, we have OBs in house all the time that they're there if we need them. But you can still, have a low intervention birth if that's what you're hoping for. So for a lot of people, like I said, it feels like kind of this middle ground where we provide evidence-based care and can kind of help individualize care to what women and families are looking for, and really promote kind of normal physiologic birth within the hospital setting.
What does the prenatal care look like? Like frequency, is it similar to when you are seeing an OB? Is it different?
Yeah. The kind of schedule that we follow for visits is pretty similar to seeing an OB, where we'll usually do, kind of a first prenatal visit, often between like 8 and 10 weeks of pregnancy, and then continue to see people monthly, and then every 2 weeks, and then every week at the end. Our actual appointments are longer, and so we spend more time talking about exercise and nutrition and other lifestyle things that can be helpful. We also offer group prenatal care at the practice that I'm at, which is a nice option for a lot of people that are looking just for more education, where we bring in doulas and lactation consultants and pediatricians that can kind of help provide some education on the forefront during pregnancy to help you kind of make decisions as you enter parenthood and are trying to navigate all the choices that will come your way. So the actual schedule we follow is very similar, but then our appointment times are longer. Not quite as long as one of the big benefits I think of out of hospital care is that the midwifery visits tend to be really long. Like you often have 1 to 2 hour appointments, which can be so nice. Our first appointment is usually about an hour and covers a lot of education. And then our appointments moving forward usually are 20 to 30 minutes, depending on what's going on. But we always welcome families to come back more often if needed. So if people have questions or just want to check in, we'll always squeeze people in if they need it.
It's super interesting, just the differences. And then of course the similarities. What is the
Yeah.
schedule for postpartum care? Do patients see you after they've delivered? Do they not see you? What is
Yeah.
the schedule for that?
Yeah. We usually like to see people back at about 2 weeks to kind of check in, and then again at 6 weeks. And same kind of thing. People can always come back more often if they have questions or concerns or want to check in. But usually at least 2 postpartum visits to check in, and then, yearly for annual exams or more often if needed, if there's other concerns that come up.
Very cool. Random. I didn't really prep you for this, so it's okay if you don't have it on the spot, but do you have any just exceptionally interesting situations or stories surrounding birth? It could be during prenatal care, it could be during delivery itself. I'm just so curious. I mean, because your schedule is neat in that you're in the hospital setting and it's pretty kind of regimented that way, but there are going to be times where you're in the midst of a birth, like what happens when they do go super long? Okay, so that was two questions.
Yeah.
So just some interesting scenarios in regard to your schedule, and then just if you have a really cool story, I would love to just kind of end with that. I mean, we're going to run out of time, but anything if you want to add, that way.
Yeah, I think in my current practice, the nice thing is that we have, interventions available if needed. And so I think one of the perks is that if birth goes really long or if someone gets just absolutely exhausted, that we have, the option of epidurals and Pitocin and other interventions if needed. And we have a lot of tools in our belt of things to try first. So a lot of us have trained in spinning babies and different positioning things that can be helpful throughout labor.
I
Lot
love
of
that you know that, by the way. I love that you do that. Sorry, I interrupted.
It's huge. I mean, and this as a chiropractor, there's like so much that goes into making birth work, and there's the things that we can control and the things that we can't. And so we utilize a lot of those things first. And then we have other interventions that we can use as needed. We work with a lot of doulas, which is super nice. And it can be this beautiful partnership of having, one person as a doula that you've met through your pregnancy and have connected with, and that then is there through your whole birth with you, which is super nice. One of the things about hospital-based midwifery care is that we do work on a shift schedule. And so there's always a chance that you may have one midwife for part of your labor and then transition over to a new midwife, depending on what time of day your baby is born. So doulas can be a really nice kind of extra member to the team that can offer support, which is awesome. I think one of my favorite things about birth is getting family members involved. And so I've had lots of births where dads have caught the babies, or soon to be grandma has caught the baby. And so we do whatever we can, when that's what a family wants, to get family involved. And I think one of the beautiful things about midwifery is just kind of knowing when to sit on your hands versus knowing when to intervene. And I think a lot of what we see about birth is, an OB catching the baby in a hospital setting where a mom is on her back and forced to be in a certain position. And, we always say midwives will catch your baby in whatever position you want. And so I've had lots of people deliver their babies on the toilet or in the tub or standing. And I'm always a huge fan of partners being very involved in the birth. And so whenever I can kind of pull a partner in and help them catch their new baby, that's always my favorite.
I love everything about that. We're out of time. That was amazing. Thank you. I love everything that you do. And I really do appreciate you sharing today. We'll see you later.
Bye.